Good day, everyone. We are the group before, and our topic is Myasthenia gravis. We're going to discuss its definition, causes, risk factors, symptoms, and treatments. My group mates are Taksha Vasquez, Dimple Oy, Keith Orsolum, Shalene Tilano, and me, Samantha Nicole Tilano. So, what is myasthenia gravis? The name myasthenia gravis, which is Latin and Greek in origin, means grave or serious muscle weakness. There is no known cure, but with current therapies, most cases of myasthenia gravis are not as grave as the name implies. Available treatments can control symptoms and often allow people to have relatively high quality of life. Most individuals with the condition have a normal life expectancy. Myasthenia gravis is an autoimmune disease, which means the immune system, which normally protects the body from foreign organisms, and mistakenly attacks itself. Myasthenia gravis is caused by an error in the transmission of nerve impulses to the muscles. So, in other words, myasthenia gravis is characterized by weakness and rapid fatigue of any of the muscles under voluntary control. It is relatively rare acquired autoimmune disorder caused by an antibody-mediated blockade of the neuromuscular transmission, resulting in skeletal muscle weakness and rapid muscle fatigue. Muscle fatigue. The autoimmune attack occurs when autoantibodies form against nicotinic acetylcholine postsynaptic receptors at the neuromuscular junction of the skeletal muscles. Although the chief target of the autoimmune attack in most cases is the skeletal muscle nicotinic acetylcholine receptor, or NACHR, other antigenic targets that are components of the neuromuscular junction has also been implicated. And next, for the discussion of the causes of the myasthenia gravis, can I have Sir Keith Orsolum?
Hello, good day to everyone. I am here to discuss about the causes of myasthenia gravis. So, the antibodies. Your nerves communicate with your muscles by releasing chemicals, neurotransmitters that fit precisely into receptor sites on the muscle cells at the nerve-muscle junction. In myasthenia gravis, your immune system produces antibodies that block or destroy many of your muscles' receptor sites for a neurotransmitter called acetylcholine. With fewer receptor sites available, your muscle receives fewer nerve signals, resulting in weakness. Antibodies can also block the function of a protein called muscle-specific receptor tyrosine kinase, sometimes referred to as MuSK. This protein is involved in forming the nerve-muscle junction. Antibodies against this protein can lead to myasthenia gravis. Antibodies against another protein called lipoprotein-related protein 4, LRP4, can play a part in the development of this condition. Other antibodies have been reported in research studies, and the number of antibodies involved would likely expand over time. Some people have myasthenia gravis that isn't caused by antibodies blocking acetylcholine, MuSK, or LRP4. This type of myasthenia gravis is called seronegative myasthenia gravis or antibody-negative myasthenia gravis. In general, researchers assume that these types of myasthenia gravis still have an autoimmune basis, but the antibodies involved are just not detectable yet. Thymus gland. The thymus gland is a part of your immune system situated in the upper chest beneath your breastbone. Researchers believe that the thymus gland triggers or maintains the production of the antibodies that block acetylcholine. Large in infancy, the thymus gland is small in healthy adults. In some adults with myasthenia gravis, however, the thymus gland is abnormally large. Some people with myasthenia gravis also have tumors of the thymus gland, thymomas. Usually, thymomas aren't cancerous, malignant, but they can become cancerous. Next up is Ms. Dimple Oy to discuss the risk factors of the myasthenia gravis.
The risk factors of myasthenia gravis, number one is female gender and age under 40 years. Number two, female gender and age over 60 years. Number 3, other autoimmune disorders. Number 4, issues with the thyroid gland. Number 5 is having undergone extensive surgeries in the past. Miss Jolene Tilano will discuss the symptoms.
Thank you, Miss Dimple. So, guys, I will be discussing the symptoms of myasthenia gravis. The main symptoms of myasthenia gravis is weakness in the voluntary skeletal muscles, which are muscles under your control. The failure of muscles to contract usually happens because they can't respond to the nerve impulses. Without proper transmission of the impulse, the communication between nerve and muscle is blocked and weakness is result. Weakness associated with myasthenia gravis usually gets worse with more activity and improves with rest. Symptoms of myasthenia gravis may present via the following body parts. For the eyes, myasthenia gravis can cause dropping of the eyelid as well as double and blurry vision. You may also experience overall weakness in your eye muscles. For the face, in addition to facial paralysis, myasthenia gravis may lead to changes in your facial expressions. For throat, when myasthenia gravis affects the muscle of the throat, you may experience trouble talking, difficulty breathing, difficulty swallowing or chewing, hoarse voice, and weakness in your neck, making it difficult to hold your head up. For the chest, when myasthenia gravis affects the muscle of the chest area, you may experience severe and potentially life-threatening symptoms such as respiratory failure caused by weakness in the diaphragm and chest muscles that may lead to myasthenic crisis and is considered as emergency. Lastly, for the arms and legs, myasthenia gravis can also affect the muscles in your arms and leg, leading to the following symptoms, such as fatigue, weakness in your fingers, hands and arms, overall weakness in your legs, and problem walking upstairs or lifting objects. So, not everyone will have every symptoms, and the degree of muscle weakness can change from day to day. The severity of the symptoms typically increases over time if left untreated. So that will be all for the symptoms of myasthenia gravis. So I'm passing the table to Ms. Rexha for the presentation of treatment for myasthenia gravis.
Thank you, Ms. Tilano. So, my name is Lakshmi Vasquez. I am assigned to tackle treatment of myasthenia gravis. As of now, there is no cure for myasthenia gravis, but treatment relieves signs and symptoms such as weakness in the arms and legs, double vision, dropping eyelids, and difficulty speaking, chewing, swallowing, and breathing. A variety of treatment, either alone or in a combination, can relieve the symptoms of myasthenia gravis. Treatment depends on age, severity of disease, and progression. Treatment to help keep the symptoms of myasthenia gravis under control include number one is avoiding anything that triggers the symptoms. Some people find that things such as tiredness and stress make their symptoms worse. Two is medicine to help improve muscle weakness. And the last, surgery to remove the thymus gland. That is a small gland in your chest linked to myasthenia gravis. Some of the treatment can do at home such as ice pack tests. In a patient with myasthenia gravis who has ptosis, placing ice over an eyelid will lead to a cooling of the eyelid which leads to improvement of the ptosis. This occurs because cooling improves neuromuscular transmission. I have here medications of myasthenia gravis. One is cholinesterase inhibitor, that is to improve communication between nerves and muscle. These drugs are not a cure, but they can improve muscle construction and strength in some people. 2 is corticosteroids such as prednisone. This is to suppress the immune system and limit antibody production. And lastly, pyridoxine, which help electrical signal travel between the nerves and the muscle. It can reduce muscle weakness, but the effect only lasts a few hours, so you'll need to take it several times a day. Pyridoxine is also increases the amount of acetylcholine available to stimulate the receptor and help electrical signal travels between the nerves and the muscle. With this treatment, most individuals with myasthenia gravis can significantly improve the muscle weakness and lead normal or nearly normal lives. Some cases of myasthenia gravis may go into remission either temporarily or permanently, and muscle weakness may disappear completely so that medication can be discontinued. Stable, long-lasting, complete remission are the goal of thymectomy and may occur in about 50% of individuals who undergo this procedure. So that's it for the treatment of myasthenia gravis. I hope you learned something about our reports. So again, I am Trixia May Vasquez, and my team is Samantha Nicole Tilano, Arsalam Kit, Dimple Uy, Shalan Tilano, and we are Group B4. Thank you.